Prostate cancer ranks as one of the most serious cancers affecting men. The American Cancer Society notes that this type of cancer is more common in men than any other form, except for skin cancer. It's believed that about 1 out of every 9 men will face this cancer at some point in their lives. In the year 2022, it's expected that around 200,000 men in the US will be diagnosed with prostate cancer for the first time, and over 40,000 may lose their lives to it. However, the chances of survival improve significantly if the cancer is detected and treated early. That's why it's crucial for men to know the early signs of prostate cancer. Most men don't really think about their prostate until it starts causing problems. Prostate cancer usually starts in the gland cells, and this type is known as adenocarcinoma, which is the most common form of prostate cancer. There are 2 kinds of prostate cancer, one that grows quickly and another that grows more slowly. The American Cancer Society points out that some men can have prostate cancer for many years without any signs or it causing problems. However, prostate cancer can be quite serious, especially if it spreads to other parts of the body. Note that this video is for educational purposes only and does not aim to replace your doctors and dietitians. Now let's dive to the 10 warning signs of prostate cancer. Blood in the urine. Finding blood in your urine, a condition called hematuria, often happens in the more severe stages of prostate cancer. There are 2 types of hematuria. The first type, microscopic hematuria, means there are red blood cells in your urine, but you can only see them under a microscope. The second type, macroscopic hematuria, is when you can clearly see the red blood cells in your urine, making it look red or pink. This usually occurs in about 3 to 5% of men with prostate cancer. It's a sign that the cancer might be affecting other parts of the urinary system, like the kidneys, ureters, or bladder. To figure out what's going on, doctors usually recommend regular urine tests. Pain in your back, hips, or legs. Prostate cancer can lead to severe pain in areas like the thighs, hips, and lower back. This happens when the cancer spreads or metastasizes to the bones in these regions, affecting the growth of new bone cells. Research has shown that men experiencing pain in their back, neck, or pelvis are more likely to be diagnosed with prostate cancer. In fact, men with back pain are about 50% more likely to have prostate cancer compared to those without such pain. This suggests a strong link between back pain and prostate cancer. Additionally, men with more advanced stages of this cancer often report feeling weak or numb in their limbs. If you're experiencing unexplained pain in your lower back, pelvis, or thighs, it's important to consult a doctor for an evaluation. Painful or burning urination. When prostate cancer makes the gland larger, it can block the normal flow of urine. This blockage often leads to pain during urination. Sometimes this pain might also be the cancer has spread to nearby areas like the urethra, bladder, or rectum. This kind of spread is a common feature of prostate cancer. Additionally, a burning sensation while urinating could be due to an infection or side effects from treatments, not just the cancer itself. During the frequent nausea and urination, needing to urinate often, especially during the night, can be a red flag for prostate cancer. This condition, known as nocturia, involves waking up several times at night to go to the bathroom. This frequent disruption of sleep can lead to feeling very tired in the morning and can negatively impact overall health. If you find yourself getting up often at night to urinate, it's a good idea to talk to a doctor about it. Sudden weight loss. Losing weight without trying can be a sign of many types of cancer, including prostate cancer. Often this weight loss comes from not feeling hungry, feeling sick to your stomach, or throwing up. Why these symptoms happen isn't fully understood yet. People with prostate cancer might also find that food tastes different. If you're losing weight and you don't know why, it's important to see a doctor to find out the cause. To avoid losing too much weight, doctors often recommend eating more high-calorie foods. Medicines can also help control nausea and vomiting. It's important not to ignore these symptoms, as they could lead to more serious health issues. Pain in the rectum. When prostate cancer reaches the area around the rectum, it can cause pain there because of the tumor growing into the rectum. This can also lead to issues like constipation, a sudden need to pass stool, inability to control bowel movements, gas, partial blockage of the bowel, or diarrhea. If you're experiencing these kinds of symptoms, It's important to see a doctor right away to get them checked out and find out what's causing them. Tests like a digital rectal exam, ultrasound, and prostate-specific antigen test can help doctors figure out if these symptoms are due to prostate cancer or something else. Pain while sitting. If a person's prostate gland is enlarged due to cancer, it can make sitting for a long time very uncomfortable. Those with prostate cancer might often feel pain or a numb sensation in the area around their pelvis, especially when sitting on something hard. This type of discomfort while sitting is commonly linked to a specific type of prostate cancer called prostate adenocarcinoma. If you find that sitting is causing you pain in your lower back or pelvic area, it could be a sign of prostate cancer. Problems urinating. If someone with prostate cancer has trouble urinating, it could be because the cancer is stopping the bladder from emptying properly. This issue can arise from the tumor growing into nearby areas or from the prostate gland getting bigger. If you're having a hard time going to the bathroom, it's a good idea to visit a urologist quickly to get it checked out. Loss of bladder control. Losing bladder control can be a sign to watch out for in prostate cancer. This condition, known medically as urinary incontinence, can show up in different ways depending on the type of prostate cancer. The two main types of incontinence people experience are stress incontinence and urge incontinence. This loss of bladder control can indicate that the cancer is getting worse. Often, treatments like radiation or surgery prostatectomy for prostate cancer can lead to this issue. The prostate plays a role in controlling urine flow, and surgery can sometimes damage the nerves involved, leading to problems like urine leakage or needing to go to the bathroom more often at night. In fact, about 25% of men who undergo treatment for prostate cancer end up having some degree of bladder control loss. Risk factors and prevention. For understanding the symptoms of prostate cancer, you might wonder if you're at risk. Factors that increase the risk include being older, certain racial backgrounds, family history, and being overweight. To lower your risk, you can eat lots of fruits and veggies, stay active most days of the week, keep a healthy weight, and talk to your doctor about your risk. If you're at high risk, your doctor might suggest certain medicines or treatments to help lower it. Drugs like finasteride and dutasteride, often used for enlarged prostates and hair loss, might reduce the risk of prostate cancer. But there's some evidence that they could increase the risk of a more aggressive form of the disease. It's best to talk to your doctor if you're concerned about your risk of prostate cancer. And with prostate cancer might have various symptoms, but many don't have any at all. It's important to remember that prostate cancer can often be treated successfully, especially if it's found early. So there's no need to jump to the worst conclusions. You notice any of the symptoms we've talked about, it's a good idea to get in touch with your doctor. For more information, you can watch related videos. Don't forget to like and subscribe for more updates. Thank you for watching.